Just record. Yeah, there we go. So good job on that. It was very interesting. Lots of different people, lots of different experiences. So that makes the class even more fun. Did everyone see the copy of the group, our group? Hold on, let's just mute everybody. Did everybody see their group numbers? I sent everybody the groups and the emails of your classmates. At the end of class tonight, I'll let you guys get together because you guys have an assignment that's going to be going next week. So let's make sure that we get together for our first group project. You'll have 2 total, I think. So, so get to know each other, you know, and divvy it up so that everybody does it fairly. What will happen at the end of the semester is you guys will rank one another as teammates. So that'll give you an opportunity to share how well you work together as a group and things like that. So that'll be pretty cool. We have our first exam next week. So I put out a new study guide. There was one that I posted earlier this week, and then we revised it. And so I would like you guys to look under your announcements, and you're going to see the new study guide there. It's a lot more material than the first one, but if I were you, I'd study off that new study guide that we gave to you, okay? We are going to have exam reviews this week. They're not all settled up with timing. I will tell you, I'm having one tomorrow night at our class Zoom at 7 p.m. Eastern Standard Time. So we'll go through the exam review. You guys can ask any questions. Attendance is not mandatory for exam reviews. It's highly, highly recommended, but you don't have to come to mine. You can watch my recording or whatever. So feel free, if you guys have class or whatever, don't stress about it. You try to make the best of it. What else can we talk about?
When do you say? I'm sorry. When do you say?
No worries. Tomorrow night at 7 p.m. Eastern Standard Time. So Wednesday. For the other exams, I'll probably do Thursdays, but I have a commitment Thursday. So we'll do Wednesday tomorrow at 7 p.m. Eastern Standard Time. Okay, on our class Zoom. And like I said, I will record them all. We'll all record, our professors all record them, and then we post them for you guys. So if you don't get to see them live, don't worry about it. Just watch them or listen to them in the car, you know, something like that, just to go over the content. My best recommendation on studying is study the study guide. You guys need to be doing your reading and stuff like that, but we really try to guide that you guys as well best we can with our study guides, okay? Any questions about prepping for our exam? Please make sure you download it. You'll download it on Sunday or Monday. Make sure it's downloaded by the time you come to class. It's on Exemplify, ExamSoft. I don't know what you guys call it, but I call it ExamSoft. Yeah. And we're going to have 2 pieces of equipment. We're going to have our computer running with the exam on it, and we're going to have our phones for Zoom. Good. And
Professor, I'm sorry.
Yep.
It's gonna be math in the exams.
Yep. 5 math problems.
Can we have like a white paper and show you to you like we
Yep.
did in maternity?
Yep.
Perfect. Thank you.
Yep. Just make sure that there's nothing on that paper. And a good thing for you guys to get in the hang of is using a whiteboard. And I'll tell you, because for some of your standardized testing that's coming up, you're going to need a whiteboard. So if you have one, it's good practice to do math on. But other than that, everybody will be muted. It's pretty much as if we were sitting in class. You know, I watch you guys and you're recorded. Don't worry if, you know, just take the test and there's nothing you worry about being recorded. We're watching to make sure nobody has their book open, kind of, you know what I mean? All right, so that's next week. And then we will not have class after the exam. So you guys are free to go when you're done. And any problems downloading the exam, just get in touch with me so I can help you, okay? Because sometimes that first one is a little difficult. It is not ready to be downloaded as of yet, though. So don't look for it yet. Any other questions about what's coming up? You have some assignments due next week too, but what I want you guys to do is focus on your studying for our first exam, okay? All right, so welcome everybody back. You guys came back. That's wonderful. You're in one piece. You've made it a whole week. That's amazing. We are so happy to see everybody back again. Anything wonderful happened this week for anybody? Come on, we need some good stuff. Nothing?
Well, today is
Come on.
your anniversary,
Yay! How many years?
14.
Whoa,
Yeah.
you're
Yeah.
making the good habit of being married, huh?
Yeah, it's being good.
That's good. Any other celebrations? Any good stuff happen? Anybody get an A on a paper? And they were like, yes, that was a good thing.
Me.
Good. All right, I have family visiting this week, so that's a good thing for me. Yay. Let's see, what else happened? Anything in the news? I don't watch the news, so who knows? How's the weather all around? Good? Good, good. Fall-like, iffy. Ty, I think are you in, somebody's in Ohio. Who's in Ohio? Yeah, you guys had a ton of rain, didn't you? No? It was a good week. I'm seeing you, Indira. You're nodding and shaking yes and no. I'm watching you there. No? All right. Well, no major tornadoes or hurricanes this week, so that's a positive, right? All right, we'll take attendance real quick. Natalie, just say here.
Here, Professor, sorry.
Thanks. No worries. Juan,
Here.
Joshua,
Here.
Nirmala,
Here.
Yasser. He's here. I saw him somewhere. Yeah, there you are. Lorelai,
Here.
Ty,
Here.
thank you. Indira, we spoke about Ohio. Ulysses. Ulysses.
Here.
Yeah.
Here, your license.
Ulysses. I can go, I'll try on this one. Charity. Heidi.
Here.
Great. Ayana. Yossi. You're somewhere. I saw you, I think. No, I didn't. Did I? Okay. I need you guys to just hold on for 1 second. I apologize.
Capitán. Sorry about that, guys. I'm here. Okay. Amoy, I just saw you
Yeah.
join. You're here. Helen,
Here.
Raina. You here, Raina?
Yeah, she's the one that celebrated.
Oh, thank you. What a good memory. Jessica,
I'm here.
Sylvia,
Here.
Nicole,
Here.
Jen. I don't think she's gonna be in our class. Jenny,
Here.
thank you. Jocelyn,
Here.
Lindsay.
Here.
All right, this one's gone. And Genevieve.
Here.
Okay, awesome. All right, so, all right, what we're gonna do tonight is we have to cover family and things like that. We're gonna do a little
Professor.
bit.
Professor, excuse
Yep.
me.
Yep.
Just in case, I'm Josie, just ladies, I'm here.
Yep, Josi is how you say it, right, Josie?
Okay, Josie.
And
You also-
Katrina.
Hold on a minute. There you are, Katrina. I don't have you on my list.
Yeah, they just put me in here.
Okay, welcome. What's your last name?
Potter.
Otter. Okay, welcome. Were you in class somewhere last week?
Yes, I was in Marvel.
Okay, great. Anybody else not on my list?
Me, Jacqueline Shewell.
Yeah, I don't know. We'll add you. I know you're here. All right. All right, so we're gonna do family tonight, but what I wanted to do was a quick Kahoot on last week because we didn't really get time to do that. So let's all do a Kahoot together on last week's material. I will post this for you guys to review for your exams. But it's gonna be a way for us to go through and see what we remember from our reading from last week. So we're going to go on to Kahoot. Everybody know how to do Kahoots?
You go to Kahoot. I think Kahoot. If you just Google it. I'm gonna give you a code in just a minute and we're gonna take a look at this Kahoot. All right, everybody on where they need to be? Are we ready to start?
Professor,
Yepers.
on the phone,
What?
the Kahoot?
You can do it on the phone or on your computer.
Okay,
You guys know how to get to Kahoot? Say no
Okay.
if you don't. If you just type in KAH, it'll come up. All right, so we're gonna start and I'll give you guys a code. PIN. Everybody there? So you go to Kahoot, KAHOOT.IT. Here's our code 8030220. You can put whatever on there. You don't have to put your name. I mean, I don't pay attention to your answers. You know, like, it's good if you answer. So you just put your names in. And then we're going to look at some of the questions. We're going to go over the answers, all this fun stuff. So for week 1, there was a lot of stuff on like OSHA, World Health Organization, those kind of things. So we're going to see those kind of questions on our Kahoot. We ready to go? We have 16, so getting there. 17, all right. Yeah. All right, let's start playing here. Here we go. Our first question is, what is OSHA? Can you guys see the answers? To pick. Okay, act that requires businesses to protect workers. 1 study hour moves you toward an A club at the hospital community, or Occupational Safety and Health Act. Oh, good. Very good. We got 17 of us knowing it's Occupational Safety and Health Act. What kind of things do we see with OSHA? What do they monitor? Anybody?
Is the protection for the patients?
So
Protection like information, you know.
Oh, that's
medical
ACA. That's
OSHA is
ACA.
going to be protecting our occupational piece of it. So who's occupational?
The
That's
employee.
to protect all of our workers. and our-
Employee.
Yeah, employees, the
Yeah.
HIPAA is the other one.
Yep. So you're going to be doing occupational safety. So it's OSHA. So think in your minds, occupation means workers. So we're going to be protecting our workers. So they come in and they make sure that we have everything we need, and we have our fire extinguishers, and we have our products labeled, and we know what the harmful effects of it is. Anybody work with OSHA at all in their facilities where they work? No, you should have had OSHA come through. No. All right, well, you'll start to see that they'll make sure that the act is being followed. So you have people that are monitoring, making sure it's a safe work environment, right? All right, so we're gonna go to number 2. What is the mission of OSHA? What's our mission? Now, remember, we're working with occupational safety. All righty, good. We have 16. So what we're going to make sure we're doing with OSHA is we're going to make sure that our environment is a safe and healthy, has safe and healthy working conditions. It's not going to be just, you're not going to have rules set for just the safety, but you're going to make sure that that environment that we're working in is a safe, clean, there's nothing in the way. We make sure that people have the right kinds of technology, things like that. Okay, so we're looking at occupation there. Good work. All right, next one is going to be a World Health Organization. What is our goal for World Health? Standards for vaccines, work to maintain peace and security, monitor adverse drug reactions, and provide support to middle income countries. It can be more than one answer. Okay, interesting. So World Health Organization, unfortunately, doesn't really care about peace and security. What they care about is they are going to care about making sure that we have things communicated. We have rules for our vaccines. We're going to make sure that we're watching drug reactions. Anybody remember who declared COVID a pandemic?
It
World
was
Health
World,
Organization.
it was World Health.
WHO, sometimes we know it as that. Okay, so they're really looking at the health and well-being of the world as a whole. Okay, we're gonna find things that we need to follow that are written by our World Health Organization. We have several organizations. What's another one that's gonna guide our medical care?
CDC.
CDC.
Yep, CDC is one. Who else is gonna help guide our medical care? I'll give you a clue. It starts with the first word is nurse. How about our Nurse Practice Acts? They're going to help us to learn what we should do and what what state by state is allowed. If anyone knows anything about, I'll use maternity as an example. So in some states under the Nurse Practice Act, you are allowed to do an electronic fetal monitor on the head of the baby if you're the labor and delivery nurse, and in some states you are not allowed. So just know these kind of things are going to guide our practice as nurses, right? So we have CDC, we have World Health. Who else do we have? No, that was in your reading. Just give me one other one. Where's our government play a part here? How's government play a part in our healthcare?
FDA.
Good. You have the FDA. What else do you have that regulates what's being paid for and what's not being paid for?
Medic-
Agency for Medicare and Medicaid, right? They're gonna warrant who is, right? Who's gonna pay for what, and is this a fair one? Who else monitors what's being paid for with in our healthcare system?
I want to say ACA, but I'm not 100% sure.
Say that again.
ACA? No.
Well,
'Cause
not
I know that ACA,
necessarily.
like, I know I have to sign it at work. Whenever I'm doing consents, I have to have them sign the ACA form because of Medicaid.
Yeah, saying that they don't qualify or they do. Is that
Mhm.
what you mean? Yeah, so
Yeah.
that goes along, yeah, that goes under the umbrella of Medicare and Medicaid, but we also think about our private insurances. Right?
Oh,
They dictate what's getting paid and what's not getting paid. So these are all organizations that I want you guys to know about and be familiar with, okay? Next question is going to be about Medicaid and Medicare, and this was in our reading, but it's which of the following meets the criteria for Medicare reimbursement for home health nursing? Family members learn how to care for surgical wounds, client who needs a sitter because she wanders, client who needs assistance with bathing, and client who needs assistance with house cleaning and meal prep. What do you think is going to warrant reimbursement by Medicare? Oops, we didn't get many there. Okay, so when we look at this question, this is going to be a test strategy. What can someone tell me about the answers that are yellow, blue, and green? What is true about all three of them? So one, a sitter who somebody wanders, needs assistance with bathing, and needs assistance with house cleaning.
None of
those ADLs?
require nursing degree.
ADLs.
Yeah, they're nothing that require a nurse involvement. Okay, the only thing, so if you had no idea and you saw this on a test, I would want you to look at your 4 options and say 3 of them don't require any nursing skill. So for Medicare reimbursement in the home health, you have to have something going on that's going to require nursing skill. Okay, or they will not reimburse for the home health because they have limitations on what they can reimburse for. Okay, so that's a big one. I do want you guys to know that that's going to be one of our Medicare things. We're going to look at the next one, which is what's the one that sometimes people will confuse with Medicare, but it really shouldn't be confused, but it sounds pretty similar.
Medicaid.
Good. What word is in the word Medicaid that can help you know what that is?
Aid.
Aid. Mhm.
Good. So when we're looking at Medicaid, we're giving aid to different groups of people. Let's take a look. Our Medicaid is our first. Health insurance for the poor, funded by the federal government, provides health insurance for the elderly, funded only by the state government. Oh, we're all over the board on this one. Okay, so when we look at Medicaid, we have the word aid in there. And that's going to tell us we're providing aid. Who else do we give? Does anyone know from our reading or know in their head? Who else is eligible for Medicaid other than the poor?
People that
Uh,
have
disabled.
significant health issues.
Yeah, disabled.
Disability.
kind of-
Pregnancy.
Yep. The thing to remember about Medicaid is that it is different state to state. So in the state of Colorado, children's Medicaid is called CHP. What's it called in Florida?
Well, it depends on the age of the child. If they're like
Okay.
1, I think they fall under Medicaid. And then anything above that, I think it's Florida Kid Care, which is still under their umbrella. But
Okay, yep. Okay, and what is it called? And where else do we have people? Where is it called? What's it called in Tennessee? I know we have somebody from Nashville. I'm sure. Maybe not.
I'm from Tennessee, but I don't know.
Okay, thank you. So it has another name. I mean, I'm telling you, it'll have a state-driven name. Know that Medicaid and Medicare, you know, everyone knows that there's some federal influence in there, but you're gonna see that more state is in there for our Medicaid. All right, health insurance for the elderly. Who's the one who gets the elderly? What are they covered under?
Medicare.
Right, and the way to remember that is care. You're giving care to people who need it. Okay, not financial need it, but what population do we serve the most of? In med surg, in respiratory, and cardiac, you're gonna serve the people that are, you know, older.
The
So we're
elderly.
very good. We're gonna care for those guys. Okay. We are going to now look at our health disparities, which is a big one that we sort of talked about. So differences in health based on ethnicity and economic circumstances. We understand it to be, I gotta move us. So we understand differences in health based on economic circumstances in order to assist in removing lead-based paint, assist in surveillance of chronic disease, eliminate health disparities, or eliminate lead-based paint. Oh boy. Oh, good. You guys picked up on when I said health disparities. Very good. Remember our health disparities. We're going to take a look at what are those kind of things. We were talking about social determinants of health. Does anybody remember what some of those things were? We talked about it last week a little bit.
Can you repeat that question?
No worries. So what were some of our social determinants of health that is going to create these health disparities?
Income,
Right?
education,
Yep. Our
Culture. Culture.
Our environment. Good. We're gonna
Type
take
of-
a look.
wouldn't
ahead.
it be type of household as well, like meaning single parent versus multiple parent as well?
I wouldn't say so much parent-based, but that's an environment kind of thing. So yes. Sorry, I skipped ahead. We're gonna skip this answer because I skipped ahead. Sorry. All right. So ethical foundation for evidence-based practice is going to be what? What do we see? Requirements in the most recent version of the Code of Ethics. Law establishing liability, importance of providing interventions, and the Code of Ethics of the SSWAA. Evidence-based practice. Good. We got 11. So what we do know about evidence-based practice is what? What can somebody who chose 11 tell me about that? I mean, chose blue, sorry. What can somebody who chose that? What do we know evidence-based practices?
It's proven interventions. It's where they've researched and documented what works for each disease process and what's more effective.
Where do we see evidence-based practice? It's not necessarily going to be with conditions. What's it going to be with? Like not, it can be, but it's not always just with medical conditions. Where else do we see evidence-based practice? What kind of things are researched and based on evidence-based practice, we put them into effect?
From pharmaceuticals, maybe like medications, or no?
I mean, that goes along with the conditions. This is something that though you guys will see over and over and over again.
I think that is the papers, just document it. Just
Vaccine.
you have to document everything because it's the only proof that we have. to
Right,
evidence.
that's true. You always have to document. But with evidence-based practice, we see this implemented in hospitals all the time. And it's where it's giving you a new way to do something as a nurse or as a healthcare professional. What is something that you guys are seeing in the hospitals that is something that they really push hard that you guys, that they want nurses to do?
SBAR?
Safety,
Maybe,
Infections?
yes, washing hands is
Yep.
proved to keep the disease away, no?
Sure, yep, washing hands, gowning and gloving, before you go into our, restricted rooms, making sure we're following our HIPAA protocols, those kind of things. Evidence-based practice is going to be what sort of motivates for technology in the workplace. So, how if you've worked in healthcare, you know that you've been through several different software systems, right? That they get a new one, they try a new one, it's based on evidence, things like that. So you're going to see that it's called evidence-based practice is nursing practice, and evidence-based treatment is going to be the treatments that we were talking about. Okay, good work. All right, this one, no. All right, what's malpractice? So it's an act or omission causing injury or damage. A breach occurred through an act or omission, deriving authority from the law, and the provider has the duty to provide reasonable care. It's 3 answers here. Oops, we're out of time already.
Ah, crap.
All right, well, all right, so malpractice is when you do something and it's not a good choice. So we're not getting authority from the law here. We are going to be getting causing damage, and it's going to be because we forget to do something or we don't provide our reasonable care. I'm not too worried. We'll do ethics after our exam, and we'll talk about malpractice there, but I just wanted to review that real quickly when we're thinking about it. We'll skip this one too, because I'm not that worried about it. All right, RN is working as a case manager with a vulnerable population. What action should the nurse do when providing care? Be willing to enter a long-term relationship with families, direct and control the client's care because the nurse knows what's needed, encourage families to become self-sufficient and less dependent, rotate assignments periodically to prevent attachment and codependency. Alrighty. Oh, wow. A lot of you guys wanted families to become self-sufficient, less dependent. What do we know about vulnerable populations? Somebody got it right.
Maybe they don't have the resources or family to help out, maybe. I don't know.
That
Poor
could be.
people? Poor people?
Homeless,
Yeah, yep. These are all examples of vulnerable populations. Why do you think it's so important to get in relationships with the families?
Since the family's gonna be their primary caregiver and they need to, be part of
Yeah,
it.
they're vulnerable populations. So these are people that are gonna have higher rates of what? Do you remember? Higher rates of what?
Getting sick, maybe
Or
going to
chronic
the
illness, yep.
hospital.
Yep. We're gonna have our homeless is under that vulnerable population. Remember, where do they get all their health care? In the ERs, right? Anybody who's ever worked in an ER. So the homeless people aren't gonna be doing that follow-up care. They're not gonna do that preventative care, with our vulnerable populations. We have several different groups that we will look at with our vulnerable populations. Okay, let's see. I'm gonna skip the next one. I don't wanna spend too much time in case management. We'll do that in another chapter. Oh, lovely. What's the purpose of Healthy People 2030? Is it promote health for those with chronic illness, emphasize health promotion and disease prevention, offer health development of children, ensure health insurance for those in need? Okay, and very good. We are going to be, if we were taking this test and we didn't know our purpose, a lot of you guys got this right, which I'm very happy to see. What made you pick health promotion and disease prevention?
The word healthy.
Good. Healthy, when you see Healthy People 2030, that's what you're working with. You're working to promote. We're going to have our different levels of prevention. Remember, we talked about this with our Healthy People 2030. We're going to have that primary, which is going to be those things that we do to prevent something from happening. And then we have our secondary, which is going to be our screenings, our mammograms, our colonoscopies, those kind of things. So what we're doing on our secondary is we're screening so that we can minimize the effect of a condition if it's occurring. And then our tertiary is when we're treating. We already have something going, and then we are treating it. Okay, so that's with our Healthy People 2030. Good work. All right, I'm going to stop our Kahoot here. I'll stop sharing. And I'm going to stop our Kahoot there. So was that helpful for a little quick review of last week? Those are kind of our emphasis. That's what we want. I will post it for you guys to play yourselves because there's still a couple more questions that you can do. But I just wanted to go over some of those. It was a good way for us to sort of review. Any questions on our information from last week? Not really. I'm going to show you a quick video. It's going to be on our evidence-based practice. And this will maybe help everybody understand it a little better because I don't feel like that was one that we got right on the Kahoot. So hold on one second. We're going to share our evidence-based practice. Okay, here we go.
As a practicing nurse or health professional, you'll need to know about evidence-based medicine and recognize where information falls on the spectrum of evidence-based, in addition to likely using evidence-based practice in class projects. As a review, what is evidence-based practice? There are three main elements. The first is research. What do the research articles or studies say about best practices for addressing or treating a disease or condition? The second element are patients and includes their values and preferences. And the third element is the clinician taking into account their experiences and judgment. There are many levels of evidence in research based on how rigorous a study is. The studies become more rigorous and reliable or use the highest level of evidence as you move up the evidence pyramid. from case studies to randomized control trials to systematic reviews. Some things that are not evidence-based are information from websites such as Healthline, the Mayo, or Cleveland Clinics. The information on these types of website is sometimes produced by doctors or other working in healthcare, but is geared toward the general public and not health practitioners and has not been reviewed extensively enough to be considered based on the best established evidence. How can you use evidence-based practice? If you need to find information about a condition or learn about suggested treatments, you can look up research that has been officially reviewed by experts and meets specific criteria. Nursing Reference Center Plus, through the library website, is often a good place to start. Many of the articles are a summary of best practices and represent evidence-based medicine.
Okay, I'm gonna stop the video right there. So that is a good website to look at if you want to do evidence-based practice, see what is the latest and greatest and how you would implement that. It also is helpful for you guys for finding information on the internet that I know we're going to be working with that quite a bit, and I wanted to just show you that, okay? So that's another reference for you guys to use on our evidence-based practice. And we have one more little video of last week, which is our social determinants of health. And so we're going to watch that real quickly. Let me just get that on going. And our social determinants of health, member, is where we're going to see those health disparities and those differences based on a couple different things. So we're going to take a look real quick. Oopsie. At a quick summary for us. Let's maximize. Okay, ready?
At HHS, we define the social determinants of health as the conditions in the environments where people are born, live, learn, work, play, worship, and age. Social determinants affect our health, well-being, and contribute to health disparities and inequities as well. Healthy People, our nation's longest-running disease prevention and health promotion initiative, emphasizes addressing the social determinants of health to create environments that promote health and well-being for all. I'm Admiral Rachel Levine, Assistant Secretary for Health at the United States Department of Health and Human Services. Healthy People 2030 provides a framework for thinking about the social determinants of health across 5 domains. Here are the 5 social determinants of health. First, economic stability. People with steady employment are less likely to live in poverty and more likely to be healthy. By helping people earn steady incomes, we can achieve economic stability for all. Second, education access and quality. People with higher levels of education are more likely to be healthier and live longer. By helping students excel in school, we can improve educational access and quality. Third, healthcare access and quality. Many people in the United States are unable to get the healthcare services that they need. Increasing access to high-quality healthcare services will ensure more individuals can attain their full potential for health and well-being. Fourth, neighborhood and built environment. Health and safety risks, like high rates of violence and unsafe air or water, impact health and quality of life. By creating safe communities, we can provide opportunities to promote playing and physical activity. And fifth, social and community context. Increasing relationships and interactions with family, friends, neighbors, and community members is beneficial to an individual's health and well-being. To learn more and see how others are working to address the social determinants of health across the nation, please visit healthypeople.gov.
All right, so there. Oops. Okay, so there is another one of the topics that we were covering last week, are social determinants of health. So I want you to think long and hard for a second about, oops, oh, hold on. Okay. About the people that are in your community, just locally around you. What are some of the social determinants of health that you see evidenced in your community? When you're driving around your neighborhood, or you're at the supermarket, or you're catching the bus, or whatever you're doing, where do you see some discrepancies there?
I live in the suburbs, so I never see people take the bus, but when I go to work and I go into the downtown area, there's always a ton of people on the bus.
And what do you notice about the people on the bus?
They're not going to their nursing and doctor and lawyer jobs.
Okay, they may not be. I mean, we don't know that because unless you've interviewed them, but what do you know about people that are taking public transportation? What are they going to have more difficulty with?
Lower income.
Possibly, or maybe they don't want to waste money on a car, or maybe they believe in public transportation for the environment. But what do we know about people using public transportation? What is going to be more difficult for them in a healthcare setting?
Trying to get to their appointments and whatnot, depending what, at least here in Florida and Miami, the transportation system is atrocious. So
Yeah,
getting
it's that
to
way in
where
most cities.
to go, it's not exactly,
Mhm.
it's not ideal.
Good. And so if you have a doctor's appointment, and I don't know if anyone's had this experience, but I've had it many times, I'm running 5-10 minutes late. I walk in the office and they say, sorry, we can't take you. And that's not because I'm using public transportation, right? So think about these kind of barriers that are going to be for people that maybe, or they're living in a community where violence is predominant. So they're afraid to go somewhere because the gangs are present or anything like that, right? So we want to think about these determinants and are we being more exposed to, clean air, clean water, things like that when we're in different areas. So all those are important to remember with your social determinants of health. Any questions about that? Medicaid, Medicare? Because this is going to be a topic on your exam, I will tell you that. No. Okay, Healthy People 2030 will also be something that we want to be looking at. You guys will have an assignment on Healthy People 2030 as a group, I believe. So I want you guys to be familiar with those sites because those are good sites to use, and they're we're going to see evidence-based practice within their data. All right, next we are going to move on to this week's work, which was on families. And what do we look at when we're dealing with families? So what we're going to do is a Jamboard, and I want everybody to participate. And you're going to give me on the Jamboard. We did one last week, so I will share with you guys now. Hold on. I'm going to share the link. And what I want you guys to do is start filling in on here. If I were to ask you to describe family, and that's all I'll say, I want you to tell me, here's our Jamboard in the chat. What do you think is family? What's family to you? So everybody remember the sticky notes that we used last week with the Jamboard? They're on the left-hand side. I'll show you. We're all doing it on the same one this week as opposed to different pages. So, okay, so here we are on the left-hand side. Here's our sticky note. Yep, somebody's drawing. That's fine. You can do that. Or you can do a sticky note like that. All right, I'm going to give you guys some time to do that. I'm not going to watch. They do that. Sorry about the video. Did you guys not, you couldn't see the video? No? Yes? Sorry, I'm late to the chat there.
Professor, I can't open this link.
The Jamboard?
Yeah. I couldn't open it last week either.
I don't know why that is. Do you have Google?
Yes, I have Google.
So you should be able to click on the link and it'll open. Do you have a Google account? Do you have a Google anything?
No.
Maybe that's why. So,
I mean, can I just Google it on the internet?
No, because it allows you access. You have to have access to the Jamboard. So I don't have Google either for email. I just sign up with a name and like it gives me some Gmail, but I don't even use it. But I have a logon for Google. So that's how I know. I don't know if that's the case, but I have a feeling that may be. Because it looks like most of your classmates are able to access it, so I think that's probably why.
Yeah, I keep clicking it, but it's not working.
It doesn't pop up on your screen.
Nothing.
What, do you have a Mac?
No, it's an HP.
Oh.
A regular.
Yeah, that's what I have too, so it's not that. All right, we are going to take a look real quickly. It looks like everybody's contributing. Thank you so much. And I want somebody other than me, because I talk the whole class. I want somebody other than me. Look at some of read out some of our Post-it notes.
Not always blood related. A
Good.
group of people that's blood related and non-blood related. Love and support. Happiness, comfort, community. My dogs. Oh, I like that one. Love, support, and encouragement.
Okay. And what I want you to look at on all our Post-it notes, because I see a trend here. What's the trend that you see among our classmates?
Basically,
Care
like,
and love.
Support and love. No?
Yeah. See how often you see love there. Now, what's the funny part is when we say, when we look at, when we are together looking at this, what love means to you and what love means to the other person who put love and support, and what love means to that person who put love in all caps, and what love means to the person who put love, support, and encouragement. What your definition of love may be very different than what everyone else's is, right? I didn't see on here, and it was interesting because I like the My Dogs one, only because a lot of times people think family is who's in your family. So tell me some, if I were to ask you who's in your family, let's see, Ty, who would you say who's in your family? You're muted. There
My
you go.
family, my son, my mother, and my sisters.
Great. And if I were to ask you, I don't want to say your name wrong, so hold on one second. If I were to ask you, Josie, who's in your family? Are you muted? There you
Hello.
are. Hi.
Hi.
Who's in your family?
Hello?
Yep, we can hear you. Who's in your family?
Nurse family? Nurse?
Well, that's up to you. I'm not telling you, you're telling me.
¿Quién está en tu familia?
My
Family
husband,
circle.
my son. This is my family,
Good.
my closest family.
Great. That's your definition of family. Lovely. Natalie, who's your definition? What's your definition?
My definition of family is me.
Or who's in it? Yeah.
Yeah, it's me, my daughter, my dog, and I have a chameleon.
Good. And a lot of people you may hear, and some people may feel, I haven't heard this from anybody. I'm going to call one more person just to see if anybody pops this. Nirmala, who's in your family?
My dad, my husband, my friends at work. That's it.
She hit it on the nail. That's what I was looking for. So what a lot of times you'll see is family doesn't always have to be a conventional family, right? How many different types of families do we see in this world nowadays? We have single parent households, we have dual parent households, we have dual gender households, we have one gender households, we have households with children, we have households with pets, we have every single thing. So when we're looking at family, this is how we want to remind ourselves of this, that family can be whatever you describe it to be. What's one important thing when you go into a household and you're going to do home visits? What's something that somebody who does home health, what is something you have to be really careful with? When you go into some culture, for sure. Yeah.
Religion too.
Don't assume who's mom or dad or spouse or anything.
Right.
When we have different opinion, each other's. So,
Good. Bias is excellent. Yes, sir. And we want to remember that when we're going into a household. Because when we're going into someone's house, it's their home. I don't think there's a lot of us that are not proud of the home we live in. Whether we keep our house clean, according to whatever, whomever comes in the door, whether we keep it messy, because that's what we like, whether we paint it purple or we paint it tan, you know, does it really matter is what's important to the person you're going into their homes, right? So if you ever think about what kind of things do you see when you walk into somebody's house, not necessarily a patient, but even like friends' houses, what are some things that you don't, a word doesn't have to be said and you know about that family?
They're
Maybe-
caring the family house for the patient, for the client.
Say the beginning of that for the patient or the client, what?
The caring that the family has for the patient.
Yeah, what kind of evidence are you gonna see that's gonna help you determine that?
Usually for me, it's when I see pictures. I don't know why. Like I see a picture and I usually like the very tight families, like at least here, it's like all the family pictures are on the wall. That for me.
They're always next to you. They don't want to go out or move around the patient. They're always asking.
Good.
Maybe
What
the
other
abandoned,
kind? Go ahead.
abandoned house when they have a low income, they don't have money to do the reparation.
Yeah, and some things to remember is as you guys are describing, when you go into a family, like Sylvia said, you see a lot of pictures, right? But what I'll tell you is if you walk into my home, there's not a whole lot of pictures. And the reason for that is I don't like a lot of things on the walls. So be real careful, guys, when it is true. And I agree with you, Sylvia, that a lot of people have a lot of photos. My sister has a whole wall of photos, but I don't like things on my wall. So I mean, what I describe as a good family. So, you know, it's just interesting when we see things and we say this defines family, but we have to be so careful as nurses, because what if it was said that the family is standing right next to you, right? And that sort of tells you they're involved. What if and there's anyone who's been in nursing knows this, what if the family is of the feeling that you're the nurse, you know everything, you go take care of it and I'll let you do your job, right? And oftentimes you'll see that in the hospital, you know, you'll be in the room and the parents or the, you know, whatever, the visitors, they go like, push themselves against the wall so that you can do whatever you need to do. So things like that, we got to be really careful with families. In our book, and I will tell you that I'm not a big fan of this, but in our book, there is a description that defines what we are going to call healthy families. Understand, I did not write the book. I think what health is when we're looking at it, I'm going to show you the list in your book so you can see it. But this is something I want you guys to focus on, because this is how, as nurses, whether we like the term healthy or not healthy, doesn't matter. What we see coming out of families that have these characteristics is behaviors that represent healthy bonding. Does it happen to everyone? No. So we're going to take a look at that real quickly. I'll share that with you now. So something interesting to see here. Can everyone see it? I know it's kind of small. I'll try to enlarge it. We are on page 343 in your book in chapter 20. So here's some characteristics that we like to look at when we're looking at our healthy families. Okay. A common term that we use for unhealthy families is dysfunctional, non-compliant, resistant, things like that. But this is when we're looking at our families that we look at, and we have our healthy families. So they're going to communicate well. Okay, you're going to hear them talk to one another. They're going to affirm and support the members. So you're not going to hear a bickering about what's going on, or Jim thinks to do this and Susie thinks you should do this with mom, and then they sit there arguing in front of you. Certainly they're welcome to their own, you know. We're going to see respect for others, sense of trust. We're going to see these families spending time together, having a sense of humor with each other. We're going to share leisure time together, shared sense of responsibility, religious core that they share, honor privacy of each member, and opens boundaries and seek to help each other with problems. Excuse me. So when you see that, think about that. And so these are some things that we look at as nurses and we say, not because they do them that they're healthy, but if we see them doing any of those behaviors, we think they may have some bonding as a family, right? They may be together as a family. So that box 20.2, I do want you guys to know those things, okay? And so when you're looking at it, I want you to do that. All right, we are at 55 after the hour, so I'm gonna give you your 10 minutes and I'm gonna say, come back at, you know what I mean? It's 4:55 my time, 6:55 Eastern time, so we'll see you back at 7:05 or 5:05 or 6:05. Okay? Okay. You're welcome. So sorry, so sorry. I'm back. This is what happens when you have family in your house visiting. They want to talk. And I'm like, I gotta go. Anyway, sorry, guys. All right, so we are back on for our second part of this class. So everybody make sure you have your cameras on. That's our regulation at Fortis, so we're turning them on. I see that. Thank you. Good job. I think everybody's here. I don't want to take attendance again, so let me just count. 1, 2, 21 to 22. That should be everybody. Okay, so we're going to look at something also that was where we talked about the different types of families. What you want to see is what is actually out there today. So U.S. Census Bureau is a big source that we use to see what kind of families are out there and things like that. So let's take a look at that real quickly. So if you go to, I'm going to share the screen with you. If you go to, and this is a really great source for you guys to have and to become familiar with when you're looking at your families and what is out there. So we look at American families and their living arrangements. And this is just a way for us to sort of identify what is out there and what we see. And now this is our United States Census Bureau. So do remember that this is going to be information that people have been willing to share. So sometimes, usually it's not, you're not identified or labeled as that. So here we look at an Excel spreadsheet. This is what our census comes up with. Okay. Oh no, not that. Oopsie. So sorry. I'm going to stop sharing for a second. Oh, so sorry. That was not you guys. That was another class anyway. All right, so we look at our census and who's around and who is out there. Okay, let me pull it up one more time. And we look at 15 years and older. So in our census, U.S. Census Bureau, that's who we look at as families. We're going to look at that. And we're going to say 15 and older. And what do we see as far as our numbers and our breakdown? So here we go. We look here. So if we look, total number that was surveyed here is 266,000. Out of that, we have 127,000 that are going to be married with a spouse present. We have 3,700 which are married with a spouse who's absent. So maybe he's in the military or somewhere else. We have 15,000 that are widowed. We have 25,000 that are divorced, and we have 4,000 separated, and 90,000 that were never married. So look here at our trend in America. We have primarily, we're going to have our married spouses and we're going to have our never married people. Okay. So when you look at that data, that's just kind of interesting. They separate it by male and female, and just so that we can see, since we have we have both in our class, we have 63,000 males that are married with their spouses, and 47,000 that are going to be never married, as opposed to our females, who are going to be 63,000 married, and then we're going to have only 41,000. So they're about equal when we look at our two gender groups and who's married and who's not. So when we take a look at, we can also look at ages of children. We look at our income here as well. So we have under 5,000 or less is going to be like 5,000 out of that 266,000. So just some interesting data to look at. Our bulk of people in the United States, based on our census, our largest number is going to be making in this ballpark in our $40,000 to $75,000 range. Okay, so you're going to see that is our largest chunk of economics. So just some interesting things that we can find. If you go back to our census website, sometimes we can see what the breakdown is on children, the number of children, things like that. Just something interesting that you guys can use to see what kind of families are out there. So when we talk about families, what are some of the things we're going to do when we're assessing a family? This was in your reading, so I'm not sure if you know. Zoom user, can I just have your first and last name? Zoom user. Hello. There's somebody on here that says Zoom user. Okay, I'll have to put you in the waiting room. Bye. Okay, so when we look at families, what kind of things are we going to be looking at?
Can you repeat, Professor, please?
Sure. When you're doing a family assessment, what kind of things are we looking for?
Living conditions,
Living conditions, yep. What else?
Income,
Maybe.
Who the patient
The
lives
support
with,
system.
Good. Support system, what else?
where the patient lives, with whom, and
Yeah,
family
your
member,
support system. I'm sorry, say that again, yes, sir?
family members that living like together.
Now, remember, family members can be blood or not blood, right? That doesn't matter. What else are we going to be looking at when we're doing family assessments?
Culture,
What kind of things, when we're going into a household and we're first assessing a family, what kind of things are we going to be thinking about?
The way they interact with each other.
Yeah, the way, safety, good. Also, we're going to look at our family histories, right? Anybody who's ever gone to the doctors for the first time, you have to fill out 17 pages about who has what in your family, right? And so we look at that, and that is something that is going to be called a genomap, genogram, like genetic. I'm going to show you an example of one in your book because I like that one. And then we also look at not just their genetics, but what kind of people are they surrounding themselves with? Where are they spending their free time? So we're going to look at their ecomaps, their environments, right? So let's take a look at a genomap, and I hope that you guys have not done one per se, but seen these before. And I think once you see them, you're going to know right away. So let's take a look here. So what this does is this helps us know what kind of things might we expect in a family based on their genetics. Okay, so if you can see it, and I wish we can make her, let me see if I can zoom it. All right, well, anyway, can everybody see it? I know it's small. I don't know how to zoom this page. All right, anyway, so we look at this up here, and what we have is we have our mothers and our fathers, okay? And we have a family member here and who had hypertension, diabetes. Then we have another family member that had diabetes and heart disease. And then we have another one that had ovarian cancer. So then we see then off of that, we're going to have our offspring and things that happen to them. So like an MI, heart attack, thyroid cancer, breast cancer. What is the kind of things that as nurses, as we're looking at this family on the left-hand side, what are some things that we are going to be worrying about with this client? If this is their family history.
Cancer,
What else?
hypertension,
Diabetes.
Yep, we see a lot of cardiac too, right? We see our hypertension, we see our heart disease, we see a heart attack. So these things are things we're going to do. Now, if we see this in a family, what are we going to do?
Teach prevention.
Good, we're going to do some primary prevention. We're going to be educating. What are we going to educate on?
The diet.
What else?
Exercises.
Nutrition, exercises.
You want to teach on the modifiable factors that will make them more susceptible to those types of diseases.
And remember, when we're talking about this with a patient, we're not going to say, oh gosh, you're really in trouble because you have all this going on, right? We're not going to freak them out, but we are going to say to them, there's a history. So, and, you know, inform them about the things they can do to keep themselves healthy. All right. If we look on this side of the family, we have autoimmune disease, we have diabetes, hypertension, cataract, automobile accident. What kinds of things are we going to be looking at in this family on the right-hand side?
hypertension as well.
diabetes too,
Mhm.
and the autoimmune disease.
Immune disease.
Good. We're gonna watch for audit, when we have something vague like that, you know, I say vague in the sense it's not very specific. It could be 1,000 things. This is just something that we're gonna keep in the back of our heads as we're treating our patients and we're taking care of them and we're helping to diagnose, you know, them, not medically, of course, but with our nursing diagnoses and all that. These are things that are gonna be in the back of our head. So if they have some random thing occur, then we know that they have this, you know, unknown disease. Oftentimes, if you see someone with an unknown cause of death, that's going to be something you want to be concerned about, because then it could be anything. And if they don't know, then that's something that you have to be even more investigative about. All right, so there's our genogram. And the way you remember that is has the word gene right in it, G-E-N. And then we look at our eco maps. Here we go. So we have this family here, and we have, who do they spend their time with? So we see that Jean spends her time working full-time. So she may spend some time with her coworkers. She does recreation, biking, cross-country, skiing. So she does in her free time. She has an extended family, an older stepmom. She's got friends. They both have friends, Bill and Jean. Bill goes to healthcare sometimes, works full-time. So what does that tell us? Maybe maybe he doesn't believe in going to the doctor or whatever. We have the kids then that are going to have, they work, they're teachers, they're coaches, they have friends. One went to college and graduate school, one plays soccer, one plays swimming. So what's going to impact these people from a health perspective is all these, you know, environmental impacts on them. Okay. Any questions on that? ECO has the word, the way I help to remember this is E is for environment and G is for genetic. We see a lot now. I don't know if anyone's had this experience, but in healthcare, genetics is like this big deal and they think everything's genetic. I mean, is it? Probably. Do we see trends with hypertension? Do we see trends with diabetes? Absolutely. Do we see it with cardiac? Yes. The BRCA gene was a big one 20 years ago when that came out. Family, family passed among families, preventative types of care, things like that. So genetics is a big part. But when we're looking at families, we just want to take everything into consideration, because who they spend their time with in the environment is oftentimes going to be someone outside of the family, right? Any questions on that? Genome map, eco map? No? All right, let's look at a nice case study. Okay, look at the case study that I have here. And let's see. Any questions on families, evaluating them? What's going to be really important that I didn't talk about when we're going into a household? Anybody know?
Being respectful.
Yes, absolutely being respectful. What else?
Safety.
Very good, Heidi. What kind of safety are we going to be worrying about?
For example, if let's say the patient has oxygen, they have to be careful because it's flammable. That's one example.
Okay.
Also, like if there's gate issues, rugs, and safety on the bathrooms.
Okay. Who else are we worried about safety for, though?
Ourselves.
Good, Joshua. Tell me what you're thinking there.
You just never know. You need to just be prepared.
What kind of things are you going to do to be prepared?
Take somebody with you.
Know your surroundings.
To take someone with you is yes, but hypothetically, sometimes there's going to be some HIPAA things, so you'd have to get like a volunteer or something to go with you. But yes, that is definitely one. What else are we going to do?
Knowing your surroundings.
Make sure somebody knows where you're at, like your supervisor or somebody that
is in the loop of the work too.
Good. What else? Where are we gonna sit when we're sitting in somebody's house?
Close to the door.
Mhm. Yep. You're not gonna sit, if you have a couch, you're not gonna sit in the couch, you're gonna sit on the outside of the couch, right? If you're sitting down, you're gonna always, good communication technique is always being eye to eye. So if you want to be eye to eye with your patient and you're gonna sit down, what kind of things might you see in a home that might be not so great for your nurse's safety?
Dogs?
Pets, yeah.
Drugs, weapons.
Yeah, weapons, what else?
Pets.
Pets?
Mhm. How about those other animals that aren't pets? Or not intended to be pets, maybe? Right? We're gonna have.
Like snakes?
Oh, wow, we really went there, yeah.
Smoking.
Snakes. Huh? Smoking, yeah. Uh-huh. And if you're asthmatic and you're a nurse and you're in a smoking household, that's gonna be a lot of fun, right? But you gotta do what you gotta do, duty calls. So you're gonna do the best you can, right? To be prepared for that. Right? And you want to make sure that you have a schedule. And like Joshua said, that schedule is going to be pretty set. You're gonna let them know what time of day you're gonna go.
During the day?
Usually the earlier the better. Daylight.
Yeah, daylight. So you don't have to go in the morning, but you definitely don't want to go at 6:30 at night. If you're unsafe, what do you do? If you feel unsafe,
Leave.
get out. Absolutely. So these are some things, and we're talk about home visits that sometimes we don't think about, but as nurses, our job is to protect yourselves as well. So remember that when you're going to someone's home. Okay. Guns is a big one. Depending on their feeling on guns and depending on how they keep them and where they keep them and if they lock them and if they don't and all those kind of things. These are going to be triggers that we're going to look for and make sure we're doing our primary prevention and educating them about the best way to keep a gun safe. Probably not something you want to have a conversation with if they have it in their pocket at the time, but we want to keep our environment and all those kind of things in review. All right, we're gonna look at a case study that I like you guys to do the case studies. It's sometimes helpful. Oopsie. I'm not sharing, am I? No, thank goodness. Okay. And here's our case study. So anybody want to read the study for us? I'll do it as a slideshow, so it's a little bigger.
I can read it.
Thanks.
Elizabeth Jackson is a registered nurse returning to school to obtain her BSN. She.
Oh, sorry. Thank you for reading. That wasn't intentional, I promise. Here we go. Go ahead.
Let's see.
She
is working in the public health department during her community health rotation. Her focus is on the holistic health needs of the family. Ms. Jackson is conducting a family health assessment on the Wells family, a middle-income family of 5. Mr. Wells is a 48-year-old man disabled from a back injury. Mrs. Wells is a 42-year-old woman in good general health. There are 2 children from the marriage, ages 12 and 10 years. Mrs. Wells also has a 22-year-old daughter from a previous relationship.
Okay, so we got our little case scenario down. Based on interviews with the Wells family, and I want you guys to put your answers in the chat. Based on interviews with the Wells family, Mrs. Jackson creates a genogram. The results reveal the paternal men were deceased in the early 50s because of cardiac. On maternal side, grandparents lived in their 90s and had dementia. Mrs. Wells' sister struggles with illness related to congenital kidney failure. The Wells children display symptoms of ADHD and require math tutors. What kind of education are we going to be giving to Mr. Wells? A, B, C, or D? So you're putting your answers in the chat there.
All right, so we got 14 answers so far. Let's take a look. All right, we got almost all B's. We got a C there too. All right, so Nicole, tell me why you chose B. Nicole?
Because of the, yes, sorry, I couldn't.
No worries.
Because of the past medical history of cardiac disease.
And what do we know about the cardiac disease? Where is it in the family?
Based on this paragraph or the
Yeah. Who had it in the family?
the paternal,
Paternal what?
the grandparents.
Yeah,
No.
but women or men?
Men.
So what are we going to be providing to Mr. Wells? Now, somebody put C, which is important, but do we think this is most important when we're educating Mr.
No.
Wells?
Not most important.
Not most important. So, right. So our answer here is going to be yes, B. And because one of the most effective ways that we assess for health and illness in a family is our genogram. And so we really need to know that on that father's, on the father's side, men die of cardiac. All right, here's our next one. Somebody read this one for me.
Ms. Jackson would like to create an eco map for the Wells family as part of her family assessment. Which of the following elements may be difficult to obtain?
Okay, so which do you think is going to be the hardest out of this eco map to obtain and why? You just put it in the chat. You don't have to put why. Which is going to be the hardest one that might be to obtain? All right, so we're getting here a lot of D's. I think all D's. All D's. All right, we're going to take a look at our answer here and we'll discuss our answer here. All right, so our answer is A. Economic risk is a key predictor of health. They often consider financial information private, and both the nurse and families may be very uncomfortable with this conversation about financial. Why did everyone pick D?
Because sometimes family doesn't like to talk about their behavior, like if there's drugs involved, some sort of like problems in the family, alcohol.
Okay,
I
so
was
the
actually
thought,
between A and B. I was between A and D, and I was like,
just take a pick.
Mm-hmm.
What's something about behavioral risks that they may not have to tell us?
Maybe when they have abuse,
Mental health.
the family.
Yeah, but if they don't tell us, what is something that we can do when we go into a home? Sometimes we can pick up on
Body
behaviors in the home.
language.
Yeah.
Yeah. Body
Mhm.
language, behavior.
Or they are saying that they may not drink alcohol, but then you see a full bar, or they don't smoke, but then you see an ashtray laying around or something. So those kind of behavioral risks are going to be easier for us to find than our financial risks, because that's something that is really hard for people to share oftentimes, and they may not feel comfortable sharing it with a nurse in their home. Okay, so that was a good one because that was kind of hard. All right, which of the following may provide a more accurate family assessment? creating a genogram and an eco map, interviewing the house of the head of household, individual assessments with each family member, or conduct a home visit. This one might be a little hard. All right, looks like A and C is our winners, but let's take a look at our answer and our rationale, and then we'll go back. So the best way to assess a patient is going into their home. What that tells you is lots of things. It tells you what goes on in the home. It tells you who lives there and all the other things, okay? You're gonna work with the patient in their home, and visiting the family is always gonna be your best assessment tool, because you're going to be able to assess a lot of things. So somebody who picked A, tell me why that may not be, why you chose A.
Because it gave you the looks at genetics.
Okay.
So the predisposition that the patient has.
Mm-hmm.
And
But what do we know?
map.
Yep.
Sorry, Professor, go ahead.
Nope, you go ahead. Eco map, go ahead.
And the eco map, you have understanding of what they're doing. So who are they with?
What do we know about a genograph and a eco map? Who's giving us the information for this?
For example, the parents, the family member.
Yeah, the patient usually, or the family member is. So we're going based on what they say, right? How many people know exactly what's happened to every single member of their family if they have a family of, say, 10 kids, all married, 22 grandchildren, so this is going to be on recall. So it's not going to be your most accurate. It's a good way to assess, but your best one is going to be when you put yourself in that home and you see what's going on. And then I don't think anybody, some may have done individual assessment with each family member, but that's not going to be really the family as a whole together. Okay, I knew that was going to be a hard one. All right. Completion of a genogram and educating the family about the findings is an example of which level of prevention? Disease management, primary prevention, secondary, or tertiary? All right, we got a C, we got some B's. What else do we have here? B's. It's like a lot of B's and C's. Okay, so B is primary and C is secondary. Okay, our answer here is going to be B. Why is it B? What are we doing here? What is the word in this question that we see?
Education.
Educating.
Very good. Very good. That's going to be primary. So when you see educating, now if this read educating the family member who has diabetes about blood sugar monitoring, what level of prevention would that be?
Disease management?
Wouldn't it be secondary?
Tertiary.
Yeah. Okay. So disease management is not going to be just so that this was an easy way to do this one. You're not going to see disease management as a level of prevention. Okay. What you're going to see with levels of prevention is always going to be your primary, secondary, and your tertiary. And when we look at something that is when we're treating a patient, okay, that treatment category is always going to be our T, our tertiary. Does that make sense? What if we run a fasting glucose on a patient in our office? What kind of prevention is that going to be?
Secondary.
Secondary. Why is it secondary?
Training.
Yeah,
Because it
we're
says
looking-
diagnostic.
Yeah, you're looking for the diabetics to pop up and not know, right? Okay, good work on that one, guys. All right, so any questions on that? Did we really covered family and things like that and ones we want to do? One thing with families that we look at is different ages, and they're at higher risk for certain things. Babies, what do you think babies are at highest risk for? Think med
Can you-
surgeon.
Can you repeat, Professor? I'm sorry.
Sure. What's our infants when we're in a household and we have infants? What's going to be one of the highest concerns with the infants?
Infection.
Safety. Yeah, getting hurt, safety. Any burns, sockets, sharp objects. Yeah, just safety overall.
What if they're 3 months
Nutrition.
old? How about 3-month-old?
Nutrition.
3 months old, you're,
Asphyxiation in the bed. I don't remember how that's called.
Asphyxia.
yeah, you're gonna worry about those newborns with SIDS, right? Back laying, no blankets, no pillows. With our little ones, like a 1-year-old, 2-year-old, what are we gonna worry about with them?
With them, it's the sockets and all the safety and the sharp edges.
And there's something else that we want to worry about with 1 and 2.
Putting putting stuff in their mouth.
Oh, yeah.
Yeah.
Maybe animals.
Hmm.
They like
You don't want them
touch
around
the
animals.
What
Yeah.
about the chemicals?
Chemicals, yeah. Remember, they're not walking till they're about 1. So what are we gonna worry about those like 1-year-olds? What happens to them that might be of concern? Starts with an A, ends with an E.
Accidents?
You're close. How about abuse, guys? We're worrying about those little ones. They're not gonna tell us I'm being abused. We may see marks, we may not. If mom and dad are abusing them, this is a really vulnerable group because they can't tell us that, right? And what ends up happening, anyone who's had children, the older they get, the closer they get to toddlerism, they want to tell you what they want to do. And if you don't have the patience or the tolerance or have had the sleep the night before or whatever the reason is, you tend to get frustrated probably. Anyone who's had, my daughter, she did it at 3, not 2, but anybody who's had the terrible 2s, my daughter was a terrible 3. She did absolutely every single thing that you could imagine a child would do, and she thought it was hysterical. So, you know what I mean? So remember this, guys, when we're thinking with our brains, we think of our own kids. She took the one thing she did, she was 2.5. She looks at me and found a penny somewhere. And I said, "Don't you dare." And she went, "Ah," and swallowed the whole thing. And I had a full-blown panic attack. And she looked at me and she smiled. And she was really proud of herself because she'd eaten the penny. And so just think about these things when we're with little people, you know, the kinds of craziness. And any parent in here has a story, I am sure of it, about something that their kid did. And how frustrating that could be if you don't have coping skills in effect. Okay, so abuse is one I'd worry about around a 1-year-old. What about school-aged kids?
Bullying?
Say that again.
Bullying. Like
Oh, bullying.
school, they get depressed.
Yeah. We do worry about mental health, but these are more like our 2nd, 3rd, 4th, 5th graders. Well, by 5th grade, they're bullying, but
Learning disabilities.
yeah, that's something we worry about. Not our major thing, though. What happens to kids when they're at school aged?
Infections, current infections.
Yeah, but we're not too worried because kids are mostly healthy, right? They're not, I mean, if we're working with a sick pediatric population, yes. But our general kids, what do? They fall off their bike. They fall off the gymnasium. They break a bone, right? We're going to worry about accidents with them because they they're more active, they're physical, right? They're getting around, they're taking their bike out. What are we going to be teaching to our school age children about? Our primary prevention with them.
Do not smoke,
Safety.
Yeah, smoking, safety, what kind of safety?
drugs,
Helmet safety, safety gear in their play.
Yep. We're going to look at helmets. We're going to teach them about drugs. We're going to teach them about healthy eating. We're going to teach them all those things as our primary prevention. And as school nurse, which is one of our chapters for this week, that is something that I've spent a lot of time doing. And you do teach them, like, you need a helmet. You don't ride, you know to stop at the stoplight and cross the crossing guard and things like that, right? So our accidents, how about our teens? What are we going to worry about with them?
With them,
Drugs?
looking at peer
Drugs.
pressure, drugs,
drugs,
smoking,
mental health.
drinking.
Sex,
Yes.
all these things. What are we going to see the most of when we've got our teenage population?
Sex.
Smoking,
Peer
Mental
pressure.
issues.
the new electronic cigars.
Electronic, well, that's a nightmare, yes, with teenagers for
higher
sure.
information on their phones, the telephone.
Social media. Driving.
Ooh, who hit it? Keyword driving, very good. What are we gonna worry about with these new drivers?
The speed.
Not putting their seatbelt. Speed.
Seatbelt. What else are we gonna worry about with them? They're new drivers. What do we know about them?
They like their phone, don't wear seatbelt,
Speeding.
Yeah.
car.
They have car accidents, right? Because they think it's good to talk on the phone and not
belt
watch the
seat.
road. Yeah,
They
seatbelts.
use the belt seat.
So we're going to do our primary education with them, and make sure we're teaching about seatbelt safety, about not using your phone, that kind of thing, right? Unfortunately, sometimes it becomes secondary, and that would be if we're asking them, what do you do when you drive? And we're screening them for them to say, oh, I don't wear a seatbelt. And so then we need to do some education right on that. All right, good. And then we do see, unfortunately, with adolescents too, we will see some abuse there. What kind of abuse do you think you're going to see in adolescents?
Sexual abuse.
Drug abuse.
Possibly. And sexual abuse, we may see that with them in their relationships, because they're not really sure what a relationship looks like. And if they're coming from a household where there was abuse in the relationship, domestic abuse or child abuse or any of it, what are they going to think about abuse?
That is normal.
That is normal.
That is acceptable.
Doesn't everybody get hit? Like, doesn't everybody get the belt or whatever? Right? So remember that when we're looking at those kids, but we're really worried about car accidents with our teens. And then what happens to our middle-aged women? What do we worry about for them? Anyone who's middle-aged, trust me, we've been there. We know this. What do we worry about?
Menopause.
What does menopause do to us?
Our hormonal imbalance.
Hormonal imbalance. Yeah.
Tell me
Yes,
more. What is that going to do to your physical appearance?
It's gonna have you gain weight. It's gonna have
Gain weight.
you.
Yep. And any female that's old enough to know about weight, unfortunately, worries about their weight or wants to be thinner or wants to be taller or wants to be this or that or whatever. Curly hair, straight hair, right? We all know this as women. And for the men, you're lucky. You guys don't worry about weight as much as we do. Hopefully, maybe you do. I shouldn't say that. That's very gender specific, but sometimes, and women in their middle, they're going to be doing those like eating disorders. They're going to do those crazy diets. They're going to do the ketos. They're going to do so we're going to worry about weight with middle-aged women. What are we going to worry about with middle-aged men?
Prostate
The middle-age crisis.
Somebody said identity crisis. What else?
Prostate health.
What else?
Mental health.
What kind of mental health are you thinking of, Joshua?
Depressed.
Risk for suicide.
Okay. Remember, there's a lot of pressure on middle-aged men traditionally. And why is that?
Traditionally, just because I guess they have the idea that they're supposed to be the breadwinners.
that
Good.
they have to provide resources for the family that they created.
Sure. And think about it, they're probably, you know, and when they're middle-aged, a lot of men are trying to get kids through high school. So are they, you know, having extra expenses there with sports or with private school or with, you know, and then the wife is on their case, you know, because she's feeling fat and ugly. So like, think about, there's a lot of pressure on the men, middle-aged men too, right? It's just a little different than it is for middle-aged women, but it's a time period where they really feel like they need to be substantial and financially supportive of a family. And so sometimes that will create pressures. What do we know about our elderly people?
Long list.
They
That
can
it
suffer
be long.
depression.
Mistreatment and abuse as well.
Our elderly, we're going to worry about abuse, unfortunately. So what happens is you get old and then you get abused. It's terrible, right? These people have lived good lives and then they are taken care of by people that they have given life to, their children, and their children turn around and treat them horrific. If anyone has done home health, if anyone's worked with geriatrics, you have seen it. I know that. And so there's a story of, it's a true, you know, nursing story. And I'd like to tell you guys these just so that they stick in your head a little bit when you're taking a test, right? So there's a kid and his dad says to him, I'm going to move in with you. So he says, okay, fine, whatever, Dad. But, you know, I don't have the money. So he says to Dad, I need your checkbook, right? Everybody knows where this story is going. So what did he do? He withdrew every cent out of his father's account. And his father had nothing. So when his father had to go to the doctors, he couldn't go because he had no money. And that man was able to look himself in the mirror and do that to his own father. So realize, guys, that just because somebody is family does not mean that everybody sees it the way that we as nurses may see it. Okay. We value people, we treat them fairly. That's in our ethical beliefs as nurses. Know that that is not the case across the spectrum. So just think about that when you guys are taking a test and wondering, well, who's at most risk? What kind of things are we going to see, right? All right. Any questions on that? Right. That takes us to one last topic. And we have 10 minutes left. And I know you guys have a class after this. And I want to give you guys some group time. So school nursing. Here's the lowdown. I've done it for 6 years now and fabulous. What are some great things about school nursing? Anybody who knows anything about a school nurse, what are some wonderful things about the profession?
The hours.
You got it. You got it. Where else as a nurse do you work from 8 to 3? You get a 30-minute lunch. You have off 2 weeks for Christmas. You have off 3 months for the summer. I mean, come on. What kind of nurse gets that kind of treatment? What else? What else is pretty cool about it?
I think also like helping a student that it's having issues at home, you can actually like realize what's going on without telling.
Right. And you know, the school nurse in a building is a safe adult because they don't have to do anything for you. They don't have to do their homework for you. They don't have to behave for you. They don't have to do anything. So you're a safety. You're that voice that they want to hear. So you just give them a smile or you say, hey, I like those jeans today. Or, hey, you know, it's amazing what kids will disclose to an adult that they feel safe around. I worked in a community where there was a lot of domestic violence and abuse, and the kids would come and plain as day say, oh, I got beat last night. And so you say, what do you mean you got beat? And he said, you know, like everybody get hit with the belt. Or one got hit with her mother's high heel shoe every other week. So the kids will be so honest to a trusted adult that being a school nurse, you're a school nurse, you're a psychologist, you're a social worker, you give resources to parents, you teach kids, you work with learning disabilities, you work with highly gifted, you work with every kid in that school building. Who else do you work with that is so important in school nursing? Other than the kids?
Administration.
Counselor.
Mm-hmm. But who else are you a nurse for in that building?
Teachers.
Every teacher.
Yeah, for the staff.
Every teacher. Yep, absolutely. And not just the staff, but the staff's kids who don't even go to the school, right? They come to you and say, oh, my kid has this. What do you think? Oh, I think the kid has pink eye. Oh, I think they lost a tooth. Oh, I think. So you're a nurse for like across the spectrum. Your ages are all the way across the spectrum. Okay. Little ones, preschoolers who don't talk, who don't really walk, all the way up through, you know, kids that are driving a car and having accidents. So realize that there's a lot of also something else that is very appealing to a lot of nurses, that autonomy. As a school nurse, it's you know, you miss that teamwork, you miss those, you know, that kind of stuff. But what are some things that school nurses are responsible for?
Like checking for lice or some
Vaccines,
testing.
Medication administration, like diabetic kids.
What else? What else do we look at the kids should have before they start kindergarten?
Immunizations.
Good. You're going to watch those immunizations. You're going to teach and educate those parents about the importance. What else are we going to be doing in secondary prevention we do as school nurses?
As Laurenti said, like administration of the medications, like
So that'd be
easily,
tertiary because we're treating, but if we're screening, what kind of screenings do you do in an elementary school or a high school? Anybody
Lice.
know?
Scoliosis.
vision,
Yeah, all you guys are right. Yep. Scoliosis, you're going to look for, screen for that. You're going to screen vision, you're going to screen hearing, you're going to try to identify things, those kids that need glasses, and maybe that's why they're struggling in the classroom, right? You're going to identify, I will tell you in the state of Colorado, well, in my district anyway, we cannot look for lice because parents got upset of the accusation that their children would have bugs in their hair, even though lice is, in my opinion, benign, but so they got really offended, so we're not allowed to look for them. So we don't even look for them, even if they say they have lice in their head. You just call the parent and say, hey, if you wanted to know, at Walmart or Walgreens, they have this stuff. It's called lice shampoo, and you can't say why you're telling them this. So it's very, you have to be really, you know, healthcare has become very customer service oriented, and somebody in here does customer service, and she was saying how helpful that'll be in nursing. But anyway, good. So that's about, I mean, I could spend the whole semester on school nursing. It's an amazing field. So many things you can do, help kids in so many ways, teach them, those young diabetics, teach them good management, glucose control, independence, things like that. All right, we are at 6 minutes to the hour. So what I'm going to do is offer this. I know you guys have class after me, so I will offer to stay on Zoom and put you guys in breakout rooms if you want with your groups. If you don't want to, you can sign off and be done. Remember, we have a review tomorrow at 7 p.m. Eastern Standard Time. If you can attend, if you can't, it will be posted. Okay, that's for our test for next week. Study guide, study guide, study guide. I'm going to emphasize that even more. Study guide, study that. Got it? What else we have this week? I know we have some other assignment. Hold on. Let me look. Don't forget attestation questions too, guys.
NCLEX questions.
What do you have?
The NCLEX questions.
Yeah, NCLEX questions. That's right. And you have a discussion post. What I will tell you is I looked at your discussion posts. Please, please, for full credit, you guys need to APA format, meaning you have to give me references. Because I'm telling you right now, you did not create the signs and symptoms for any of those ailments.
Professor,
Yep.
the discussion has to be in APA format too?
Yeah. That's part of the rubric, actually. So if you look at the rubric, that's part of it. Every paper we write in here is going to be an APA format. Now, I'm not saying you need a cover page and all that stuff, but what I am saying is you do need references, and you need those evidence-based references. That's part of the rubric on your discussion post and on your responses too.
Professor, I have a question about the APA and when we're doing the papers. I think APA 7 no longer requires a running head.
So
it
don't
took-
worry about running heads. I don't care
I
about
don't
them.
have to worry about the running head, right? Okay.
Nope.
Because the running head really makes my head run. because
No, running head. I'm not,
Okay.
guys, I'm not being that particular about it. When I say APA, what I'm saying to you is you cite where you're getting this information
cite where
from
we're getting our
and you
information.
put it at you put it in the writing and you put it at the bottom. Because I
Correct.
can tell you, I saw 4 or 5 discussion posts that have no citing and I can't give credit. Because you guys are, didn't come up with the signs and symptoms of all these ailments. Okay, but now we're at 5:56, so I don't want to say anything else. Anybody want to stay? Let's just show by a raise. If you guys want to stay to get into your groups, then stick on. If you want to sign off and you're good to go, then best of luck on studying. Contact me if you want tutoring. I'm around, I can help. Like I said, I write the exams with the other professors, so I know what's on there, so it's always good. Otherwise,
right after, I'm sorry.
yeah.
Yeah, some of us, myself, I'm not able to stay because I have the quiz like in 5 minutes.
Yeah. Okay, don't worry. So if you can't stay, sign off and email your group. If you want to stay and talk to your group, I have nothing to say to you guys as the group as a whole. You guys can figure it out each other. And I have a list of who's in what group, so I can put you in those groups, okay? Otherwise,
Professor,
yeah.
really quick. Okay,
Yeah.
so the difference between Medicaid and Medicare, Medicaid is for poor people, low income people, and Medicare is for old people, the elderly, right? This is the difference?
Yeah.
Okay, thank
It's a
you.
major difference. Remember aid and care. That's how you remember it.
You mentioned about breakout group rooms.
Yeah, for the
What do you mean?
groups.
What do you mean?
So I sent out to you guys an email and it was your groups for your group projects.
So you're just saying like if we have any questions in regards to that, you're saying?
No, if you guys want to talk to your group members, that's all.
Oh, okay. Yeah,
Okay.
when I know it's something like week 7 or something.
No, it's next
already-
week. You guys have a group project. Yeah, next week you have a group paper or project or hold on. I'll tell you what it is. I know it's next week. Yeah, it's next week.
Yeah, I saw
So
something like week 7 and 9 or week 7 and 11 or something like that.
no,
but-
7, you have another group project, but a week 9, that's an individual project.
Oh, that's all I saw. I didn't see nothing about next week, but
Yep.
I gotta read it again, I
Yep.
guess.
So your case study, Healthy People 2030. You're in groups. There's 3 different case studies.
Professor.
Do we pick it
follow
or
up-
is the case study assigned?
I'll let you guys pick it. I usually assign them, but you guys can pick it. I feel like you guys know what. Yeah.
Professor, quick question.
Yeah.
Jumping back on the Medicare and Medicaid situation. In my case.
Yeah, that's
I'm-
on your test, so yeah, go ahead.
Yeah, because Medicaid, at least for me, I do have it for my elderly clients as well. Because
Yeah, you
that's the
can,
one
if
that
they-
pays
they're
for the nursing
economic.
home and pays for everything.
Yeah, so, but it's income based on the older people.
Right, because they have the old, right, because they're older and that's usually who pays for their nursing home.
And so a
also-
lot of times they'll qualify for Medicare and then they'll change
Yeah,
to
they'll have
Medicaid.
both. They'll have, a
Mhm.
lot of mine have both. They
Mhm.
have Medicare because they're over 65,
Mhm.
and then they have Medicaid because, at the end of the day.
And Medicaid will cover more.
Exactly, it covers all their other extra stuff.
Yeah.
Okay, okay, all right, okay, thank you.
But just remember on the aid, we're really looking at income
But
based.
you're really primarily looking for that, no, just so that I don't get confused, because since I work with both spectrums.
Yeah,
although
you
I
know way
know-
more than even I know, so.
No, I just want to make sure I don't get confused, okay?
No,
thank
no worries.
you.
All right, guys, do you want to break out in your groups?
Thank
Those
you,
people that are
Professor.
left?
No, thank you,
Sure, sure,
Professor.
sure.
Have a
Good
good
night,
night.
Peach.
Okay,
Yeah.
Thank you, bye.
good night. Those that are left, some of us are left. All right, Lindsay, you want to meet with your group? Your group 4 and Yasser's here and he's, oh no, he's.
If anyone's here.
Ty, are you here? Nope.
Yeah, that's what I was gonna say.
Jessica?
If I looked at the right thing, I have like 2 or 3 people that I've never met before. I don't have no way of getting their information. So I don't
So
know.
I
how-
sent in there the emails, their emails as well. It's on the right-hand side of that list.
Okay, all right.
And so what I want you to do is, when we end class tonight, you send them an email and you say, hello, you're part of my group. What are we doing? You have to choose a case study and work on it for next week. Okay. I tried to put you guys together. I had several people ask to be put in certain groups. So if you didn't ask to be put in a group, then I randomized you guys.
Okay. Joshua, what group are you in? You're in 6. Nirmala,
I'm here, 6 as well.
good. All right, so we have 2 6s, so I'm gonna put you two together in a breakout room, okay?
Okay.
Okay, and then, all right, guys, I put you in a room. Indira, you are in group 6 as well, so you're going with them. And Jacqueline, you're in group 5.
I was
No, I
sticking
know what you,
around-
yep, don't worry.
Yeah.
I know what you're here for.
Okay.
And Lindsay, you are in which group? 4, but nobody's there, huh?
Oh, well.
You tried. You made an effort there. What I would do is same as what I just told, I think it was Juan. Make sure you send out an email when we get off here and you send saying we need to pick a case study. Let's get together.
Okay, thank
Any
you.
problems you have, text me and I will reach out to them, okay?
Okay.
Okay. Good night. All right, Jacqueline, so you want to see where my info is, right?
Yes, because I'm wondering if, because I was a late ad, I'm not seeing everything.
No, it's all there. I'm showing you my screen right now. so
Okay.
yeah.
Now, are you looking at it as the instructor view or the?
I can do it.
student?
It doesn't matter. It'll look the same
Okay.
on this page, but here, I'm in student view. So if you go under modules. And you go under. Getting started. No. Where's about your instructor? The only person that says me this, and I'm wondering why it's not showing. Hold on.
See,
All
and
right.
that's exactly what I see.
That's weird.
And so when you said that it's there, I was like, okay, I must be missing it because I went through every single possible screen and I just couldn't find it.
Right, so I will share with you mine and I will show you. See, it's right here on mine. About your instructor.
Oh, okay, yeah. I see that on yours, but it is not on mine.
Yeah, so it gives my experience and what my degrees are, but what you really want out of here is my phone number.
Yes.
Just know I'm on Mountain Standard Time.
So am I. I'm in Utah.
Oh, welcome to Mountain Standard Time. It's so nice to have somebody on my time.
Yes, it really
Isn't
is.
it? Never get anybody. So you and I are in the same time frame, so I don't even worry about it. So what I will tell you is that I get about 160 emails a week from just being at college here. So what I would suggest to you is text me if it's something urgent. If it's something minor, like, hey, I have a question, blah, 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 then just send it to my email at
Perfect.
So just take that number, you see it.
Yeah, I do have a question for you. So last week, I'm going to be honest with you, my instructor was kind of all over the place. So like right now, I'm kind of struggling with the whole primary, secondary, and tertiary. So I want to make sure that I understand it correctly. So primary is where you do the education. You're educating the patient on prevention.
Right, there's nothing wrong with them. It's healthy
Okay.
people, it's school-aged kids, it's what else? Vaccines is a big one on our primary. Okay, because they're healthy people, we're giving them stuff to prevent them from getting sick.
Okay, so vaccination, education, but there is no disease.
No.
Perfect. Okay. Secondary is where they have been diagnosed.
No.
Okay.
Secondary is where you're screening for the diagnosis. So you're screening, you're doing a mammogram, you're doing a, hi guys, I'm just reviewing, you guys can log off. You're gonna do mammograms, you're gonna do blood pressure screenings, you're gonna do glucose screenings. Because what you're trying to do is find those people that may have something and prevent that from getting worse. Right?
Okay.
Indira, I'm just reviewing with her. If you want to stay on.
We
you
can leave. I can
Yeah,
leave,
sure.
right?
Yep. Okay, bye.
Bye.
Okay, so secondary screening, so glucose, mammos,